All right, get ready because today we're taking a deep dive into drug distribution.
Yeah, we're talking about how medications actually move through your body.
It's pretty wild when you think about it. I mean, you take a pill
Right.
and somehow it knows where to go.
Well, sort of. That's where this concept of apparent volume of distribution comes in.
VEED, right.
Exactly, Veed. It's a key concept in pharmacokinetics, helps us figure out where a drug hangs out in your body after you take it.
So is it like a map of the drug's journey?
Kind of, yeah, like a
Really?
road map, but it's not a physical map or anything. It's
Oh,
more like a calculated value,
gotcha.
a ratio, really, that compares, how much of the drug is in your whole body versus how much of it is in your blood plasma.
So if a drug has a high VEED, does that mean it's mostly in the tissues, not just
Well,
floating around in the blood?
you got it. High VEED means it's more of a tissue traveler. Low VEED, it prefers to stick to the bloodstream.
Ah, okay. So what makes a drug choose one path over the other?
Well, a lot depends on the drug's own chemistry.
Makes sense.
Like take diazepam, for example. Diazepam, it's really lipophilic, loves fats.
Oh, so it's drawn to the fattier parts of the body.
Exactly. Easy for it to cross cell membranes, get into those fatty tissues, and that gives it a larger VEED.
So it's like it's dissolving into the fat.
In a way, yeah. Now, on the other hand, you've got drugs that love to bind to proteins in the blood,
Okay.
like albumin.
Ah, so they're hitching a ride on the protein highway.
Exactly. And because they're bound to those proteins, they can't spread out as easily.
Right, stuck in the bloodstream. So does that mean protein binding leads to a smaller VD?
Yep, you got it. Smaller VD because they're not as free to roam around, so to speak.
But it can't just be about the drug itself.
Right.
Like, what about the person taking it? Don't things like age or overall health come into play too?
You're absolutely right. The person's physiology plays a huge role.
Okay.
For example, someone with more body fat,
Right.
they're going to have larger VDs for those fat-loving drugs, just more space for the drug to spread out.
Okay. Starting to get the bigger picture now. But why does any of this matter? Like, why should we even care about VEED?
Great question. Because VEED is crucial when it comes to figuring out the right dose of a medication.
Ah,
If a drug has a high VEED,
yeah.
remember, it's going everywhere, spreading out.
Right.
So you need a higher dose to make sure enough of it actually reaches the bloodstream.
To actually have an effect.
Exactly. You need enough to fill those tissues and still have enough left over in the blood to do its job.
Makes sense. So for a low VEED drug, you'd need a lower dose.
Exactly. Because most of it's staying in the bloodstream anyway.
I see. Wow, this VEED thing is really making me think differently about how medications work. It's not just popping a pill, it's a whole journey.
That's a great way to put it. VEED gives us this behind-the-scenes look at what happens after you swallow that pill.
I'm definitely starting to appreciate the complexity of it all.
It's pretty fascinating stuff.
So it sounds like VEED is a really important tool for doctors.
Oh, absolutely.
Like when they're deciding, okay, what's the right dose of this medication
Huh.
for this specific person?
Yeah, exactly.
Yeah.
Like I was saying before, if a drug has a high VEED,
Right.
you got to give a higher dose
Yeah.
to get that desired effect.
Yeah.
But VEED helps tailor treatments in other ways too.
Oh, how so?
Well, think about people with kidney or liver problems.
Okay.
Their bodies might handle drugs differently.
Right.
So their VEED for certain medications could be all out of whack.
Ah, so doctors would have to adjust the dose accordingly.
You got it. That's why understanding VEED is so important for those patients, especially, the ones with complex medical conditions.
Wow, so it's not just a one-size-fits-all thing.
Nope, not at all. It's like everyone needs their own custom-made map for how their body handles medication.
A personalized approach.
Exactly.
This is making me realize just how complicated drug therapy really is. There's a lot going on behind the scenes.
Oh, for sure. And, even with VEED,
Yeah.
it's not a perfect predictor. There are still limitations.
Okay, like what?
Well, for one thing, VEED assumes that a drug is evenly distributed throughout the body.
Right, we talked about that.
And, well, that's not always the case in reality.
So it's more of an average then.
Yeah, exactly. It gives you the general idea, but it can't pinpoint exactly where every molecule of the drug ends up.
Makes sense. Kind of like, the general traffic patterns in a city.
Uh-huh.
But you don't know exactly how many cars are on each street at any given moment.
That's a great analogy.
So VEED gives us the big picture,
Right.
but not necessarily all the fine details.
Exactly. And here's another thing. VEED by itself, it doesn't tell you how a drug is actually going to affect the body.
Right, that's pharmacodynamics, right?
Yep, that's it.
So we've been talking about the where of the drug's journey.
Uh-huh.
Pharmacodynamics is more about what does the drug actually do once it gets there?
Precisely. How it interacts with the body, produces its effects.
So it's kind of like Veed sets the stage, and then pharmacodynamics is the main act.
That's a great way to think about it. And you really need to understand both
Right.
to get the full picture of how a drug works.
It's like two sides of the same coin.
Exactly.
Okay, so we've covered a lot of ground here.
Okay.
Veed helps us understand where a drug goes, how much we need,
Right.
and even some of its limitations.
Uh-huh.
But I want to bring it back to our listeners for a minute. How can understanding Veed actually help people manage their own health?
Oh, that's a great question. I think the biggest thing is it helps you be more informed. If your doctor prescribes a new medication,
Really?
don't be afraid to ask about its VED,
Oh, yeah?
what it means for you.
And then how does that help?
Well, it lets you have a more in-depth conversation with your doctor.
Okay.
Make more informed decisions about your treatment.
So you're not just blindly following instructions.
Right. You're an active participant in your own healthcare.
You're taking charge.
Exactly.
This has been really eye-opening.
Yeah, it's fascinating stuff, isn't it?
It really is. But I have a feeling you might have a few more insights up your sleeve before we wrap up.
Well, I did have one final thought.
Okay, let's hear it.
We've talked about how VED differs between drugs, right?
Mm-hmm.
But have you ever thought about how VED might change within the same person?
Oh, interesting. Like as they get older.
Exactly. I mean, think about it. Our bodies change so much throughout our lives.
Yeah, that's true.
So how might those changes affect how a drug is distributed?
Wow, I've never thought of it that way before.
It's something to ponder, right?
Definitely. It really highlights how dynamic this whole field of pharmacokinetics is.
Absolutely. There's always more to learn.
Well, this has been another incredible deep dive.
It has been fun.
And a huge thank you to our listeners for joining us.
Yeah, thanks for listening, everybody.
Yeah, it's wild to think that our bodies are constantly changing and that affects how we react to medications.
Yeah, it's like our own internal pharmacokinetic landscape is always evolving.
Exactly. And I guess that's why it's so important for doctors to really consider the individual, like their age, their health, when they're prescribing something.
Yeah, you can't just assume one dose is going to work for everyone.
Right. Like what might be fine for a younger person could be way too much.
Right.
Or even too little
Yeah,
for someone older.
exactly.
So Veed, it's like a moving target
Kind of.
as we go through life.
Yeah, I like that. Moving target. It's always shifting.
It makes me think of those analogies we were using earlier, like the swimming pool or the pitcher of water.
Right?
It's like the size of that container might actually change over time.
Yeah, you got it. The
Like-
pool gets bigger or smaller.
Exactly. And that changes how diluted the drug gets.
Right.
So we've talked a lot about how Veed helps us understand like the big picture of where a drug goes in the body.
Uh-huh.
But I'm curious, are there ever cases where like a drug might kind of concentrate more in certain areas?
Oh, absolutely. VED gives you that overall view.
Right.
But the reality is some drugs have a particular fondness for certain tissues.
Like a favorite hangout spot.
Exactly. Some antibiotics, for example, they
Right.
tend to accumulate in bone tissue.
Really?
Yeah, which can be great if you're trying to treat a bone infection.
Makes sense. So it's going right where it needs to go.
Right. But then on the flip side,
Yeah.
some drugs might concentrate in places like the liver or kidneys.
Okay.
And that can actually increase the risk of side effects in those organs.
Ah, I see. So it's important to know not just like the general area a drug is going to,
Right.
but also like the specific spots where it might end up.
Yeah. It's like knowing not just the country a traveler's visiting,
Right.
and also the specific cities and landmarks they're going to see.
Yeah, that's a great way to put it. And I guess that's where understanding both pharmacokinetics, like Veed, and pharmacodynamics
Right.
becomes really crucial.
It's all connected, you got to look at the whole picture.
This has been such a fascinating conversation. It really makes you appreciate just how complex drug therapy is.
Oh, yeah. It's not as simple as it might seem.
And to our listeners, we hope this deep dive has kind of sparked your curiosity about what's happening inside your own body.
Exactly. I always say knowledge is power.
Well said. The more you understand about how medications work,
Right.
the better equipped you are to take care of yourself.
Couldn't have said it better myself.
Well, it's been a pleasure exploring this topic with you,
Likewise.
and we hope you'll join us for our next deep dive into the world of health and science.
See you next time.